Hello everyone, my name is Kimberly Collins A. Paleg, a BSN 1B student. So for today's video, I will going to perform assessment of the 12 cranial nerves. This examination will give us information regarding the transmission of sensory and motor messages, primarily the head and the neck. So before we'll start, make sure the curtains or doors are closed to provide privacy. So first thing to do is to identify the patient and assess the patient's ability to assist with all the procedures, and also to explain the purpose of the examination and answer any questions. Good morning, ma'am. So I'm Kimberly Collins A. Paleg. So I will be your nurse for today. So ngayon, ma'am, I will going to assess your cranial nerve. So before I'll start, ma'am, may I know your name?
Riza A. Paleg.
Okay. Okay, ma'am. When is your birthday, ma'am?
March 16, 2010.
Okay. What do you want me to call you, ma'am?
Riza na lang po.
Priza. Okay, ma'am Priza. I just want to make sure if there is any pain or discomfort.
Wala naman.
Wala naman. Okay. So, ma'am, I will going to assess your cranial nerve, ma'am. So, no, I will going to touch some part of your body, and also there will some movement you'll need to do. Okay lang po ba yon?
Yes.
So, shall we start, ma'am?
Sure.
Okay po. Okay, so prior to perform the assessment, we'll need to perform hand hygiene to avoid contamination and infections. And then we're going to start by assessing the olfactory nerve, or what we call the cranial nerve 1. Olfactory nerve is responsible for the sense of smell. But before that, ma'am, I want you to clean your nose first. Thank you, ma'am. So, now, ma'am, I will going to check your nose. Okay, ma'am, dito po. Okay. So, ma'am, I want you to close your eyes and then close one of your nostrils. So, ma'am, I want you to describe the order. I want you to identify the item that I will give you. Okay, ma'am? Okay na po ba? Ready na po? Okay po.
Coffee.
Minsan naman po.
So,
Okay na po. Thank you. So, as I observed, the nasal passages are clear, and also I observed that the patients can describe the odor, and also the patient can identify all the items I gave to her. Next, we're going to assess the optic nerve, or what we call the cranial nerve 2. Cranial nerve 2 is responsible for the sense of vision. Now we're going to check for the visual acuity of the patient. So we will be needing a Snellen chart to do this. But for now, I don't have a Snellen chart. But by the way, the visual acuity is the degree of details of the eye that can discern an image. So Snellen chart is used to check for visual acuity. So the patient will stand 20 feet away, and we're gonna read out loud the letters each line. The result of the visual acuity can express as fraction, such as 20/20. If the patient has 20/20 vision, it means that the patient visual acuity at 20 feet is normal. But if it's 20/40, the patient needs to be 20 feet away to see objects like people normally can see. But if it's not 20/20, it may indicate that the patient needs eyeglasses or contact lens, and it may also indicate eye condition, injury, and eye infection. So now we're going to check for the visual field and light reflex. Ma'am, sabihin mo sa akin, okay, kapag na-identify niyo po yung ginagawa ko. Ready po? Sige po, focus po sa aking mata. Ma'am.
Okay. Okay. Okay.
Ma'am, stand po, ma'am. So, cover po yung isang kamay. Then, focus po dito sa aking mata. Okay, ma'am? Okay, ma'am, ready po?
Ready. 1, 2,
Please, ready po.
1, 2, 1, 3.
Okay po. So, ngayon po, ma'am, uupo ka na. So, now, for the light reflex. So, we need to dim the light to do this. For the moment. Okay? So, ma'am, I need you to focus dito sa part na yon. Focus po, ma'am, okay? Okay, ma'am, ready po? Focus po, okay? Ma'am. Okay? Okay. So, based on my observation for the visual field, the peripheral vision is normal since the patients can identify what I've done earlier, and so for the light reflex as well, the pupil reacts to the light, so it's normal. Ngayon po, ihilaw po ulit natin. So now we're going to assess for the oculomotor nerve. It is afferent to the brain. So it is examination for 3, 4, and 6 cranial nerve, which is the oculomotor, the trochlear, and the abducens. So now, I want you to focus sa may pen ko, ma'am. Okay, study lang po. Okay? Follow po ito. Ready, ma'am? Ready po? Sige po. Okay. Okay? Now, ma'am, I want you to focus. Dito. Okay, ma'am. Okay. Now, we're going to need to dim the light. Just a moment. Okay. Ma'am, steady lang po. You need to focus sa my eye ko. Okay, ma'am, ready? Sige po. So, based on my observation, it functions well. So, it's normal. I didn't observe any involuntary shaking movement or what we call the nystagmus. The pupil both are equal and well round, and it is both pupils constrict, so it indicates normal findings. And now we're going to check for or assess the trigeminal nerve. Now we're going to put gloves. So, ma'am, for the moment, I'll just put my gloves. So, okay. So, ma'am, I want you to clench your teeth. Okay. Okay, ma'am. Clench your teeth, ma'am. So, we're going to check if there is any pain or discomfort or some vibrations or pressure. So, trigeminal nerve is both sensory and motor. And now, I want you to open your mouth and then for resistance. Okay. Okay, and now, ma'am, open your mouth lightly. Okay. So now we're going to check for the two reflexes, which is the corneal reflex and the jaw jerk reflex. So now for the jaw jerk reflex. So, ma'am, lightly. Open it lightly. Lightly. Okay, ma'am. I'll just put my finger here. And then... Okay. For the corneal reflex. Ma'am. So, up. Okay. Okay. So, based on my observation, there is no wasting of muscles in the trigeminal nerve, and there is no deviation as I check it. And for the observation for the two reflexes rather, the corneal and the jaw jerk reflex. For the corneal, my patients blink as I did the procedure, so it indicates normal findings. And for the jaw jerk reflex, there is absence of reflex, which indicates normal findings, and I didn't observe or I didn't see any abnormalities like increase in reflexes. And now we're going to proceed to assess the facial nerve. This is both sensory and motor. So now we're going to check for the sensory. So for the taste sensation. Now I want you to give something, and ma'am, I want you to identify the taste. Okay, ma'am?
Sugar po.
Okay. So receptacles. And now, ma'am, I want you to wrinkle your forehead for me. Okay, and now again, ma'am. Okay, and I want you to smile like this. Okay, now I want to close your eyes and check for the facial nerves. Okay, very good. Again, okay. And now I want you to do this one. Okay. So now for the reflexes, corneal reflex and glabreal top. So earlier I did the corneal, which is normal. So now for the okay. So as you can see, my patient's blinks. So that indicates normal findings. So if the patient didn't blink, it indicates abnormal findings rather. So based on my observation, I didn't see any abnormalities or like disorder like paralysis that causes Bell's palsy and other disorders in the facial nerve. So there is no any abnormalities. So facial nerve functions well. So I think all is normal. So now we're going to proceed to assessment of the vestibulocochlear nerve. So now, ma'am, I want to whisper something and then tell me what is it. Okay, ma'am? Okay.
You're beautiful.
Okay.
Thank you.
Okay. So now for the range test and Weber's test. Okay. Just get my equipment.
Yes. 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 Yes.
Based on my observation, my patients can interpret the information I gave to her. She can identify all the things, and she can hear what I whispered while ago. So it indicates normal findings. So now we're going to for the next assessment. So we're going to check for the glossopharyngeal nerve, the cranial nerve 10, which is the vagus nerve. Now we're going to check for the gag reflex. So ma'am, I want you to drink this water to check if there is any difficulty in swallowing. Again, ma'am. So do you have any pain or discomfort? Okay, now I want you to say
Ah.
Okay, now I'm going to check your palate and uvula, ma'am. Wait a moment. Okay, that's okay. Now I want you to puff your cheeks like tightly, like here. Okay. So for the glossopharyngeal nerve, it is functioning well since I didn't see any dysfunction or any impairment of sensation, impaired in taste. So all is normal since there is no difficulty in swallowing as well. All is normal, and it all the glossopharyngeal nerve rather is functioning well and intact. So now we're going to proceed for the accessory nerve, or what we call the cranial nerve 11. So no inspecting for any wasting of muscle. Okay. So based on my observation for the accessory nerve, it functions well since as per as my inspection, there is no wasting of muscles, and I didn't observe any damaged nerve in the cranial nerve 11. Functions well since it is my patient has a normal resistance when I shrug, and for the resistance of the head and for the neck. So all is normal and seems to be fine. So now we're going to proceed for the last cranial nerve, which is the cranial nerve 12, or the hypoglossal nerve. Okay, ma'am, for the last assessment, I want you to move your tongue side to side. Okay, now I want you to press your tongue against your cheeks, and I'm gonna put a pressure on it. Okay, ma'am. Okay, for the other side. Okay. Based on my observation for the last cranial nerve, which is the hypoglossal nerve, I don't see, or I did not observe any involuntary movement. There is no wasting of muscles, as well as the protruge of tongue. So it functions well since this speech or the swallowing of my patients is normal. So now we're going to disregard our gloves. And put it in the receptacles. And then we're going to perform hand hygiene. And now we're going to document all the findings. Okay, everyone, so that's how we assess the cranial nerve 1 to 12. And for the last thing to do is don't forget to document all the findings.